just wrapped up partnering with colleagues right here in the state of North Carolina, not too far from our corporate office. And we wanted to share with everyone some of the most common questions that we heard from the audience. So we have our flip chart paper over here. What we like to do is go around the room when we're actually in person with colleagues, and we like to hear from them. What are some of their muddiest points? We highlight usually at least 3 of the most common gap areas, which tends to be facilitate learning and socialization, which is the one that we've chosen to share with you all today. But we also had curriculum and we had exam analysis. And of course, we had a parking lot option as well. So we put them all here so we can just take a look at exactly what their questions were. All right, so the first one was item analysis, right? No surprise. Well, there wasn't anything specific on the note, but this is what we want to say about item analysis. First of all, be knowledgeable about where your muddy points are. What is that specific differentiator or concept that is really causing you to feel like this is an overwhelming part of your study plan, of the competencies that you're taking a look at? So look at that blueprint, identify where your gaps are, identify where the difficulty is as it relates to the analysis. And then you want to take a look in Billings and Halstead. Specifically, we would recommend starting with chapter 25. Okay, this is going to give you some excellent evidence-based practices related to exam writing as well as exam analysis. That is a great way to ensure that you have a solid grasp of concepts related to exam analysis, is to first understand the why and the what regarding exam question development. All right, so let's keep going. The next one says, for nurse educators who are strictly hospital-based with other nursing backgrounds progressing to CNECL. So I don't really see a question here. What I would say is, when you're looking at the CNECL blueprint, you want to validate what are these specific behaviors that I'm using in my everyday work, and which ones of them do I never see, do I never experience? This is going to help identify your muddy points, your knowledge gaps, and then you want to use Billings and Halstead as your primary textbook, and then also Teresa Shellenbarger C&E Clinical Review. Okay, we will include both of those resources right here in the description. All right, so let's keep going. If you take the CNECL and want to move into classroom teaching, should you wait and take the C&E? This is a great question, and we actually talked to a colleague separately about this question. It always starts with the blueprint. I know you hear that over and over again from us. And this is because this is truly the roadmap that guides you about the next steps you want to take on your journey. Whether you decide to take C&E or CNECL first is totally up to you. We just want to make sure you're fully prepared for whichever one you decide to take. And then the next question, which is an excellent one, how do you choose which exam? You all have probably already guessed it. Starting with the blueprint, starting with those specific behaviors that you're going to be tested on is a great first step. Discrimination with test items, how do you interpret? Going back to the actual definition of discrimination, which is all about the point by serial index, you want to differentiate between your high scoring students and your low scoring students. How did they perform? How did they score as it relates to the correct options and incorrect options? And then the last one that we'll cover in this snapshot is going to be different learning theories. I need to help to break them down. We know that tends to be a large gap area too for colleagues. And we have included right here in the description a learning theories exercise. It's actually a chart that the content experts created that will help you identify what are your muddy points related to each of the theorists. And then you're going to use table 14.1 to help close those knowledge gaps, clarify concepts, and most importantly, align with the teaching strategies that you're using with your students every single semester. We hope this snapshot has been helpful, and we'll keep doing more of these Q&A sessions because we really do like connecting with our colleagues about questions, specific questions they have to help them on their journey. Until next time, have a great one, everybody.